Welcome back. November is Diabetes Awareness Month. The rates of diabetes and obesity have increased in this country. Researchers from Gallup and ShareCare found over 11% of adults had diabetes in 2016, up from over 10% in 2008. In total, the Centers for Disease Control reports over 23 million people have been diagnosed with diabetes. Another 7.2 million are believed to have the disease but are undiagnosed. Diabetes is also reported to be the 7th leading cause of death in the United States. And joining us now to talk about all of that is Dr. Brian Robinson, an endocrinologist with St. Peter's Health in Helena. Doctor, good morning.
Good morning.
Thanks for being here. So I guess to start off, just tell us, what is diabetes?
Well, most people now are more aware of diabetes because, like you said, it's becoming more prevalent. So diabetes is when your body just doesn't use sugar properly, or energy. We think of it as a sugar problem, but it's really an energy problem. When you take in food, you take in energy from food sources, your body doesn't use it properly, doesn't store it properly, and that results in high blood sugars and then, of course, down the road complications from that.
And usually when we talk about diabetes, we hear it as type 1 or type 2. What are the differences there?
Well, in type 1 diabetics, we used to call that juvenile onset diabetes, where a patient doesn't make insulin, their pancreas stops making it because of maybe their immune system has attacked their pancreas. But we're finding more and more today that older people are getting it. It's much more common. So basically, type 1 diabetes means that there's no insulin production, and type 2 diabetes means that there is insulin production, but the body doesn't use it properly.
And what are some of the possible root causes why we're seeing an increase in this?
Well, the number one cause of the increase in diabetes today is because of obesity. As the population of the United States and throughout the world actually is becoming more and more overweight and obese, type 2 diabetes is becoming much more prevalent.
And does that just have to do with the food that we're eating, the exercise that we're getting, or what are some of the causes then of obesity?
That's probably true. Throughout the world and in the United States and in Montana, high caloric foods are becoming more affordable, and people are moving more from a lower social class into a more middle social class where food is more affordable. People are gaining weight, and therefore diabetes is becoming more prevalent.
So what are some of the active steps that you can take in your life? Is it just going to a restaurant and not choosing that sugary soda and maybe water, or be more exercise, or what are some daily things people should know to do?
Yeah, but all of those, like you said, are important things. As we said, obesity and weight gain is the primary cause of diabetes. And so, like you said, going to a restaurant and taking half your food home instead of eating it all there, or spending 30 minutes a day walking. Pick a place from your house that's 15 minutes away and walk there and back every day. And just little things like that make a big change in your lifestyle.
Now, if you're not diagnosed with diabetes, but maybe you have concerns about it, is there an easy way to get tested, or how do you go down that route?
Well, public health issues regarding diabetes are difficult because some people have better access to health care than others, but if you want to be screened for diabetes, a lot of the programs in town, like employers oftentimes now have screening programs for chronic disease that a lot of people participate in. If you're not involved in any of those, you can seek care from your primary care doctor. There are also screening events oftentimes in the city during Diabetes Awareness Month. St. Peter's Hospital also has diabetes awareness events going on from time to time as well.
All right, perfect. Such important information to get out. We appreciate you stopping by to talk to us, Dr. Brian Robinson.